if counsellors have to make the choice between some socially attractive thing like tea dances for the elderly and some not so attractive thing like a day centre for mentally ill young men that only their mother could love, which way is it going to go? And before I leave that, this thing about the public, listening to the public, let me tell you something. I'm a Hackney MP, and I've been a Hackney MP for 25 years. If the only people I listen to about antenatal care in Hackney were the people that write to me, email me, ring me, set up organisations with pretty names and come and see me, stop me at cocktail parties, if they were the only people I spoke to about antenatal care in Hackney, I would believe that the most pressing antenatal need in Hackney was to make it possible for middle-class women to have their babies standing up underwater to music, because those are the people I hear from almost without exception. As it happens, because I've represented the area for 25 years, and perhaps more important, I have friends and family who live there in very similar areas, I know the real antenatal challenge in Hackney is very young girls that don't go near any form of healthcare or antenatal care until they're almost due. But the problem is, if you give these decisions to counsellors, who are often not coming at them with any level of expertise and are subject to all sorts of electoral style pressures, that communities with social capital will be able to exercise more agency than the most deprived and marginalised and voiceless community. But let me move on.
Diane, could you bring your
I
comments to
will
a close?
indeed. I will
Thank
indeed.
you.
It's the view, and I don't like to bring party politics into it, but it's the view of Andy Burnham, who's the Chancellor Secretary of State, that the key to creating a world-class NHS is to bring together social care, health care, and mental health, bring the funding streams together. The better to get best use of those funding streams in difficult times, the better to try, and we've heard about the problems of integration, but the better to genuinely integrate and stop those struggles between healthcare and social care, and particularly to obtain parity of esteem for mental health. So we believe, and we're arguing, and I think a lot of other people are arguing for, is bringing together and integrating the different healthcare streams. It's also important, and that's what I was referring to earlier, to deal with the social determinants of ill health. Because I think NHS spend accounts for 10% of people's ill health. So this country was amongst the first to build a world-class healthcare system. There is an enormous amount to be proud of. A generation of people like my mother helped to build this world-class healthcare system. But there are many challenges ahead in difficult financial times. But if we keep the patient at the core of our thinking and ignore the siren calls of institutional self-interest and personal ease and comfort, we can move on and maybe in decades to come look back and be proud of the way we built on the post-1945 legacy. Thank you very much.